11 at 5.
The landscape of medical care in the region is another step closer to changing after the state of Tennessee puts its support behind the merger of the region's two largest healthcare systems. You're watching News Channel 11 at 5. I'm Sarah Diamond.
And I'm Josh Smith. The Tennessee Department of Health Commissioner Dr. John Dreisner made the announcement just before noon. The state has granted a certificate of public advantage to Wellmont Health System and Mountain States Health Alliance, basically saying yes to their merger proposal. The two health systems plan to combine under a new name, a company called Ballad Health. Dreisner called the process unprecedented and said there is, quote, a clear public benefit to the health and well-being of residents of the region. That really has been the key. This is not the final step for the merger to take place, as the state of Virginia still has to make its own ruling on the request there. We are in your corner with team coverage tonight on this announcement that will most likely affect the health care of everyone in the Tri-Cities region. We begin with Jordan Moore, who's in our Kingsport newsroom tonight. Jordan, today's announcement comes after an incredible amount of time and effort by both health systems.
That's right, Josh. Sherry, today marked a major milestone in what's been a very long process for the region's two largest healthcare systems. It was back in April of 2015 when the longtime business rivals went public, announcing their plans to merge. Now that the state of Tennessee has approved their request more than 2 years later, we found out what's next.
It takes a real concerted effort to go down this process for the 2.5 years that we've been pursuing the COPA in Tennessee and the cooperative agreement in Virginia.
The state of Tennessee's Department of Health officially putting their stamp of approval on the proposed merger between Mountain States Health Alliance and Wellmont Health System. So now, according to the terms of this application, the two healthcare systems have 90 days to complete this merger to officially become a new system they're calling Ballad Health.
We'll also begin the process of planning for what needs to occur operationally for the transaction to consummate in early 2018. Now that the state has approved it, it allows us to work a little bit more closely on some of those plans, which we couldn't have done before because we are still competitors.
But there's still another piece of the puzzle, the state of Virginia's approval.
We still have the opportunity to work with Virginia as the Department of Health there evaluates our application there. Their work continues, and we're certainly working very closely with them to make sure we answer all their questions. We're going to keep working with them and hopefully get them comfortable so that they could approve it.
And a decision from officials in the state of Virginia is expected by September 30th. For now, reporting live in the Kingsport newsroom, Jordan Moore, News Channel 11 in your corner. Josh?
All right, Jordan, thanks. Hey, we spent the last couple of years, 2.5 years, asking Wellmont Health System and Mountain States Health Alliance executives and board members your questions about the impact of the merger. Team coverage continues. Nate Morbido was there. We got to, at this 2 o'clock kind of news opportunity, get some more specifics. Major points you took out of this today.
All right, number one, jobs. I mean, I still remember you and I multiple times in a conference room here interviewing the executive leadership team of this future Ballad Health. You found out last year $25 million a year in labor cost savings there would be because of this merger, but since then executives wouldn't really nail down a specific number of the job losses. Generally saying that there'll be administrative jobs, maybe some duplication of services that would free up some savings, and through kind of attrition. People quit, people retire, they don't fill the jobs. Well, today we got an exact number. 250 positions will be eliminated. In the short term, that was a big point. What they will say, what Ballad Health will say is in the long term, the investment and the savings spent on that investment will result in more jobs than those that are lost. That was number one.
One thing that I took away, and I'd love your take on this, is that they, being Mountain States Wellmont, really didn't know until less than 24 hours ago that this was going to get state approval.
Yeah, even as recently as a couple weeks, I was getting some information from one of my sources that said, I don't know, right. And what they told us today was that, number one, last night is when they really found out, and number two, there was really kind of this tough negotiation between the executives of both health systems and the state of Tennessee, the Department of Health, and in the end, Wellmont and Mountain States had to give up some local control to the state of Tennessee so that there was some more accountability. And initially, Ballad Health didn't want to give up that control, but eventually they did so that this deal could happen.
Not a done deal yet. Still a couple more hurdles to jump through. Nate, I know you're going through everything tonight, and you're going to be back with more at 6. We appreciate that.
Everything from facilities to the cost and to insurance. If you have insurance, how this is going to impact you. We'll have all that at 6.
All right, Nate, thanks so much. Sarah?
Josh and Nate, the proposed merger between Mountain States Health Alliance and Wellmont Health System is something ETSU President Dr. Brian Noland says he has supported since the beginning. News Channel 11's Justin Soto is live at Johnson City Medical Center, part of Mountain States Health Alliance. And Justin, you just got off the phone with Dr. Noland.
Well, Dr. Noland says this comes after over 2.5 years of hard work. And this announcement from the Tennessee Department of Health gets them one step closer to an enhanced regional health system, as well as new opportunities at the university. Noland feels this will allow for enhanced care, greater coordination across the system, and a chance to deepen the university's partnership with the potentially combined health systems. The hospitals wanted to join forces because of the potential of getting purchased by companies outside our region. Noland says that could damage many of the existing programs.
We have thousands of clinical rotations for nursing students, physical therapy students, medical students, residents embedded within these two healthcare systems. So if something were to occur other than the merger, a lot of those educational opportunities could have been put at risk.
And he added that this is a chance to grow specialties in the College of Medicine and to bring new programs to the region, especially in pediatrics, with the pledged investments over $8 million annually in research funds to the university. And Johnson City Medical Center right behind me is one of over a dozen hospitals that would combine from Mountain States if this merger were to go through. And coming up at 6, you'll hear from Johnson City's Mayor David Tomita about potential economic growth with this new potential merger. But for now, reporting live in Johnson City, Justin Soto, News Channel 11 in your corner.
Justin, thank you. We mentioned this is not a done deal yet. Virginia's health commissioner has until September 30th to make a decision about the proposed merger in Virginia. After they extended their deadline, that was earlier this month, and the two companies would be required to close on the transaction by the end of the year. We learned today it could go into the 1st of 2018. We will continue team coverage of today's merger announcement coming up at 6 o'clock.